today for our COVID-19 update. We have an additional 723 new cases diagnosed with COVID-19 in British Columbia, one of whom was epidemiologically linked, bringing our total number of people diagnosed with COVID-19 to 40,060. That includes 135 new people in the Vancouver Coastal Health Region, 456 in the Fraser Health Region, 10 people on Vancouver Island, 82 people in the Interior Health Region, and 40 people in the Northern Health Region. We now have 24 active cases across the province, of whom 346 are in hospital, 83 of whom are in critical care or ICU. Additionally, we have 11,947 people under active public health monitoring and 28,948 people who have recovered from COVID-19. Today is one of the most tragic days we have had yet, where we've had an additional 28 people die from COVID-19, bringing the total number of people who've died in British Columbia to 587. And all but 2 of these people are elders and seniors who were in long-term care homes in various places across BC. These are family, these are friends, these are people who've had interesting and challenging lives and have had spent this last 10 months dealing with the challenges that we are all facing with this pandemic. And our condolences go to the families, to all of those who cared for people, and their communities who lost loved ones. We mourn with you again today. Thankfully, we have no new healthcare outbreaks to report today, and the outbreak at one of the acute care units at Burnaby Hospital is now over, and the outbreak at Rotary Manor and Northern Health is also now over. We do still have 57 active outbreaks in long-term care and assisted living, and 8 in acute care units, involving 1,875 people, 94 residents with active cases still, and 671 staff. As we talked about yesterday, we now have at least one safe and effective vaccine that has been approved for use in Canada, and the start of immunization will be happening very soon. By this week, the first people in British Columbia will have been immunized. And as we shared yesterday, our COVID-19 immunization program will be starting, and this is an important, encouraging milestone for us in our response to our pandemic here in British Columbia. But I would like to remind people we are not yet through this storm. We continue to have many new cases, and even in the last 24 hours, people have lost parents, grandparents, aunts, uncles, friends. We still have a long way to go before we can have the confidence that our communities are all safe and protected from this virus. We don't want to fall back just as we're beginning this push forward into the final leg of what has been a grueling and long challenge. It is when we are tired when we may stumble. And now, when we have a finish line that is in sight, we need to pace ourselves and need to continue working together, even though we are tired. No matter how much we want to resume those activities that we enjoy and that are important to us, right now we need to continue to work together, to follow the orders that we have in place, to reduce our contacts, to use our layers of protection all the time, to make sure that we are doing everything we can to keep those we love and those we don't know and our communities safe. The process to receive, distribute, and administer COVID-19 vaccines is complex, as we heard yesterday. And in these early stages, the details are changing quickly. Even today, we've heard 3 different updates on what is happening with the vaccine that we're to receive in a few short days. There is so much that is still in flux. That's why our province-wide immunization program framework has been built to allow us to be adaptable and to be in step with every change as it happens. It's also why we all need to be patient. The sequence for the immunization that we have in BC has been carefully considered based on our pandemic goals and is aligned with what we have across this country to protect those who are most vulnerable to severe disease and to death, to save lives, and to minimize the disruption that we have within our communities across the province. I know that many of us are very anxious about when we will have access or when our family will have access to the vaccine. Until then, we need to keep these goals in mind and know that we are doing what we need to do to protect those who are most vulnerable. Your turn may be in the coming weeks. It may be a month from now. It may be in a few months. But for every person that gets that vaccine, all of us will be a little safer, and we need to remember that as well. There will be a time when we can take our masks off, when we can hug our loved ones, when we can travel to see friends and family, when we can be together again. We will get there, but we are not through this storm yet. That time is coming. Let's make the coming weeks, though, break by breaking the chains of transmission in this province. So for now and over the holidays, and I'm reminded that Hanukkah, the Festival of Lights, starts today at sunset. Let's stay apart, not because we don't care for each other, but because we do. Because we want those we are closest to be here when we can be together again. Let's help each other by staying small, staying local, and pushing back COVID-19. And let's remember that this, more than ever, is our time to be kind to each other, to be calm, and to be safe. Thank you.